Hi, in this session we'll discuss about the peptic ulcer. Actually, peptic ulcer, the condition in which there is the formation of lesion. Lesion mean wound in the acid-bearing region of the stomach or in the duodenum, which is the first segment of small intestine. The condition in which the formation of lesion mean wound in the acid bearing region, only the acid bearing region, which consists of small intestine, first segment, duodenum, and the stomach. In the acid bearing region of stomach or duodenum. As we know that duodenum is the first segment of small intestine. Actually, this is the condition in which the formation of lesion in the acid bearing region of the stomach or in the duodenum. This is the basic introduction about the peptic ulcer. Now, in the other word, peptic ulcer mean the imbalance between the aggressive factor and defensive factor of the stomach. What is aggressive factor and what is defensive factor? In the other word, peptic ulcer mean imbalance between the aggressive factor and defensive factor. Defensive factor of the stomach. There are two main factors which is present in the stomach, which are produced by the stomach. First factor is aggressive factor. Aggressive factor are hydrochloric acid, and next is pepsin and gastrin. This is the aggressive factor. Now, the defensive factor of the stomach, which provide defensive system against this aggressive factor in the stomach in pathological condition or in physiological condition, the defensive factor. Defensive factor consists of mucous membrane, and bicarbonate HCO3. These two are the defensive factor. First of all, we will draw the general structure of the stomach, then we will define this defensive factor and aggressive factor, that how imbalances occur inside the stomach which cause the peptic ulcer. For example, this is the general structure of the stomach. This is the esophagus. This is the stomach. So this is the fundus, and this is the body. This is the antrum, and this is the duodenum, and this is the pyloric region of the stomach. Actually, the aggressive factor which is produced by the stomach are hydrochloric acid and pepsin. These hydrochloric acid and pepsin are produced by the stomach parietal cell. They are secreted by the parietal cell, which is present in the stomach different layer. These are actually the aggressive factor which are responsible for the protein breakdown. These are responsible for protein breakdowns, and they also help in digestion. Now, the defensive factor which is present in the stomach are mucous membrane, and next is HCO3 bicarbonate. Now, there are 4 different layers which is present in the stomach. This is the first layer, second layer, third layer, and this is the fourth layer. First layer is mucosa, second is submucosa, and third is muscularis, and fourth one is serosa. This is first, second, third, and fourth. First layer is known as mucosa, submucosa, muscularis, and serosa. Actually, these layers are made from protein. So, if the defensive factor of the stomach, such as mucous membrane and bicarbonate HCO3, are not present, so these 4 layers of the stomach will be destroyed. So, there is a barrier present between these layers and the acidic environment of the stomach, which are the hydrochloric acid and pepsin. So this layer this is a barrier. This barrier consists of hydrochloric acid, mucous membrane, and bicarbonate. So these are the defensive factor which provide the defense mechanism against hydrochloric acid, which provide the acidic environment. If in normal physiological condition, there is a balance present between the defensive factor and aggressive factor of the stomach, which aggressive factor which consists of hydrochloric acid and pepsin, gastrin, and the defensive factor which consists of mucous membrane and bicarbonate. Actually, bicarbonate neutralize the hydrochloric acid. They neutralize the hydrochloric acid, and mucous membrane provide the barrier between the hydrochloric acid. If in physiological condition, there is a balance present between this defensive factor and aggressive factor, but in pathological conditions such as the peptic ulcer, there is imbalance between present the defensive factor and aggressive factor. If imbalances occur, if these this barrier are break down, so the hydrochloric acid will easily eat these different layer of the stomach, and they will cause the peptic ulcer. Ulcer will be the result in this condition. So now the causes of peptic ulcer. There are different causes of peptic ulcer. The causes of peptic ulcer. There are different causes of peptic ulcer, like tobacco use. Large amount of tobacco use will cause the peptic ulcer. Alcohol and too much spices, stress. And the main important cause of peptic ulcer is H. pylori, bacterial infection. This is the most common cause of peptic ulcer or ulcer, duodenal ulcer or gastric ulcer. So H. pylori, mainly H. pylori bacterial infection will secrete. They will secrete the urease enzyme, and they will also stimulate the catalase enzyme. Urease enzyme will break down the layer of the stomach. They will break down the layer of the stomach, and catalase enzyme will inactivate. They will provide the inactivation of neutrophil activation. They will inactivate the neutrophilic activation. The H. pylori will also produce adhesion molecule. They will also produce the adhesion molecule on the surface of the stomach or in the duodenum, which is the first segment of small intestine. So due to this adhesion molecule, this bacteria will stick on the surface of, on the surface of the stomach, and they will cause the destruction of the different layer of the stomach and will cause the ulcer. Actually, the H. pylori bacteria will break the layer of the stomach. They will break this layer of the stomach. So if they break this layer of the stomach, the hydrochloric acid will easily eat this layer of the stomach. So ulcer will be the result. Another main cause of peptic ulcer is NSAID. Too many use of NSAID, non-steroidal anti-inflammatory drugs such as aspirin. They will also cause the peptic ulcer. NSAIDs are actually the non-steroidal anti-inflammatory drug like aspirin, ibuprofen, etc., etc. So the NSAID will also cause the ulcer, because here in said non-steroidal anti-inflammatory drug block both of the cyclooxygenase 1 and cyclooxygenase 2 enzyme. If they block the cyclooxygenase enzyme, so the inhibition of prostaglandin will occur, and as we know that prostaglandin cause the inflammation, but they will also stimulate those cells which produce the defensive factor of the stomach, such as mucus and bicarbonate, which neutralize the hydrochloric acid. So NSAIDs will also be cause the peptic ulcer. Now the types of ulcer. There are two main types of ulcer. First is gastric ulcer and second is duodenal ulcer. Gastric types of ulcer. First is gastric ulcer. Gastric ulcer will be occur in the stomach. This will be occur in the stomach. The hydrochloric acid will act on the stomach layer, on the stomach different layer such as muscularis layer or another layer. So here in gastric ulcer, the stomach epigastric vein will be occur. They are present in the stomach. So epigastric vein will occur. Epigastric vein will occur after food intake. After food uptake, the epigastric vein will occur. Why the epigastric vein will occur after food uptake? Because here when food enter into the stomach, so the hydrochloric acid will automatically release and they will act on the lesion, the wound which is produced in the layer of the stomach. So the hydrochloric acid will act on the layer of the stomach and epigastric vein will be produced. Here in gastric ulcer, the gastric ulcer will increase with food. They will increase with food. So weight loss will be occur here in the gastric ulcer. Weight loss will be occur. Here in In gastric ulcer, the desire of food will also be occur, because after food intake, epigastric pain will occur, so food desire will also be occur here in the gastric ulcer. There are some symptoms, some sign and symptom of the gastric ulcer. Vomiting will be there, vomiting occur, epigastric pain will occur, and there is burning or itching in the or the upper abdomen. Burning in upper abdomen will be occur here in the gastric ulcer. Sometime bleeding will also occur in 20% patient. The bleeding will also be the result of gastric ulcer. Now second one is duodenal ulcer. Duodenal ulcer. As we know that what is duodenum? Duodenum is the first segment of small intestine which start after the stomach. So if the ulcer occur in the duodenum, which is the first segment of the small intestine, so this ulcer are called the duodenal ulcer, which is present in when there is a lesion formation occur in the duodenum. It is the most common type of ulcer. It is the most common type of ulcer, duodenal ulcer. So here in the duodenal ulcer, the pain will be occur after 1 to 2 or 2 to 3 hours after the uptake of food. Pain occur after 2 to 3 hours of food uptake. This is the pain phenomena for the duodenal ulcer. The duodenal ulcer will decrease with food. If we take the food in duodenal ulcer, so they will relieve. This is the reverse of the gastric ulcer. In gastric ulcer, if we take some food, so the gastric ulcer pain will be increased, but here in duodenal ulcer there is no pain with intake of food, so they will decrease with food. If they will decrease with food, so weight gaining will be occur here in the duodenal ulcer. Weight gaining will be occur here in the duodenal ulcer. In the duodenal ulcer, no vomiting will be occur. Here in the duodenal ulcer, sometime in severe condition, this is the symptom of the duodenal ulcer. So in severe condition, the blood occur in the vomiting, or sometime vomiting will be not occur, but in some time the blood will occur in the stool. So that's all about the basic and different types of duodenal ulcer. Now we will discuss about how to diagnose the peptic ulcer. How to diagnose the peptic ulcer. There are different tests which is present in the laboratory for the diagnosing of peptic ulcer. First is the most common which is used in the lab is upper GI endoscopy. This is the most common. H. pylori test will also present. H. pylori test, and other is serology. If the upper GI endoscopy are not work easily, so then we use the endoscopy biopsy. This is the most accurate test which is used in the laboratory for the diagnosis of peptic ulcer. This is most accurate. Now the treatment of peptic ulcer. Treatment will occur on the basis of condition, on the basis of pathological condition. Treatment. First treatment is combination of antibiotics. Combination of antibiotics will be used if the ulcer is causes from the H. pylori. H. pylori bacteria. So the combination of antibiotic will also be used. And other drug which is used in the treatment of H. pylori are hydrochloric acid lowering drugs such as proton pump inhibitor. PPIs are uses. PPIs means proton pump inhibitor. Proton pump inhibitors such as omeprazole, esomeprazole, etc. are used in the treatment of peptic ulcer. So that's all about the peptic ulcer.